State Senator Jim Robey, Chair of the Health and Human Services Subcommittee, representing District 13 in Howard County. As most of you know, this is going to be a very challenging year for not just those of us in my subcommittee, but for the entire legislative branch and for the governor. I think you've heard about challenges that not just Maryland faces, but all states, the nation, and other countries in the world face with the economy right now. I will say this, that we're doing much better than many others, but we still have challenges facing us. The subcommittee that I serve as chair really deals with some of the most difficult situations that we in the state of Maryland face. People who are the most neediest, those who are without health insurance, those who have a problem feeding their families, paying their rent, folks with mental illness, developmental disabilities is a major challenge, drug and alcohol addictions, all that comes before my committee. And it's easy to say, well, we're no longer going to fund this and that. When you sit down and look at the unintended consequences of the public that we serve, it's very difficult for us to say we don't want to continue funding these programs that give children a head start, to help families feed themselves, to help people find jobs. It's a real challenge for us this year. But the four subcommittee members know we have a real challenge, but we also know we're up to the task. We're going to do everything we can within the the budget that was submitted to us by the governor to continue providing as best we can for the needs of these very special people. I think anytime you face challenges like this, you're not going to be able to do everything you want. There are those who would like to see more money provided for these issues. There are some who say, well, we give them too much. I think what we're faced with right now is the budget as proposed presents challenges to us to make sure that we don't cut from programs that make a difference. But we're going to have to make some really tough decisions. The money's not there to do what everyone wants to do or we should do. So we're going to have to prioritize like every other committee is going to have to do down here. But to make sure that when we prioritize, we look at really the critical needs and not just, well, this would make it better for this family or this person, but where the difference between life and death, sobriety and intoxication, death on the street versus having a shelter to go to. These are the things we have to balance very carefully.